Hi, I'm Dr. Denise Carbonell, ophthalmologist specializing in ocular inflammation and immunology, or uveitis, at the Medical City South Luzon. Today I'll be talking about uveitis, which a lot of patients are not familiar with and we should look into more. So, what is uveitis? Uveitis is actually a group of inflammatory diseases that produces swelling and destroys eye tissue, which reduces vision and severe vision loss. It may be caused by problems or diseases affecting the eye itself, or it may be part of an inflammatory diseases affecting other parts of the body. It may be for a short time, meaning acute, or for a long time, meaning chronic. The severest forms of uveitis recur many times, and uveitis can affect patients at any age, and it's one of the leading causes of preventable blindness worldwide, accounting for around 10% of it. Approximately around 15 to 100,000 people will be affected by uveitis, and around 50% of those is associated with diseases affecting other parts of the body. It is caused by inflammatory responses inside the eye. As we know, inflammation is a natural process that responds to tissue damage, germs, or toxins, and it produces redness, heat, and destroys tissues. Uveitis may be either infectious or non-infectious causes. For infectious, it may be viral, bacterial, or parasitic. For non-infectious, causes may include attack from the patient's own immune system, or we call it autoimmunity, tumors or cancers affecting the eye or other parts of the body, bruises or injury to the eye, meaning direct accidents or hits into the eye, or previous eye surgeries. Patient with uveitis experience blurred vision, redness, eye pain, light sensitivity, floating spots in the vision we call floaters. When counseling with patients with ocular inflammation, we use the term or abbreviation RSVP, meaning redness, light sensitivity, change in vision, and pain. So although non-specific, any of these symptoms should prompt a patient to seek medical attention. It's actually based on the location of where the inflammation occurs in the eye. So we have four types. One is the anterior uveitis, which is actually of inflammation that occurring in front of the eye and usually occurs in young patients and middle-aged patients. And it mainly occurs in healthy people also and may only affect one eye. But some are associated with other diseases like rheumatologic, skin, gastrointestinal, lung, and infectious causes. Patient may experience symptoms of eye redness, eye pain that is worse when reading and or wakes at night, light sensitivity, and blurred vision. The second type is intermediate uveitis, so it's actually the inflammation in the middle part of the eye. We call the jelly part, as we call it, the vitreous. It is commonly seen in young adults and is linked to several common systemic diseases like multiple sclerosis. The third type is posterior uveitis, which is inflammation at the back of the eye, and it is not as common as anterior uveitis, but is more serious than anterior uveitis. So it tends to be more serious, and it causes scarring in the retina, which is we call the film of the eye, and there are many infectious and non-infectious causes to posterior uveitis. The fourth one is panuveitis, meaning the infection in all layers of the eye, meaning the anterior, the intermediate, and posterior. And it is the severest forms of uveitis and may recur from time to time. It causes blindness if it's left untreated. So for the infectious, we have tuberculosis, which is common in the Philippines, toxoplasmosis, syphilis, or the STDs, or sexually transmitted diseases, CMV retinitis, AIDS, herpes zoster, or shingles, as to name a few. For the non-infectious or autoimmune causes, here are some lists: the reactive arthritis, rheumatoid arthritis, or ulcerative colitis, Vogt-Koyanagi-Harada, and all the lists listed here. Consulting with an eye specialist, physical examination, recording of the patient's complete health history are key factors to identify if the patient has uveitis. Basic exams such as visual acuity, slit lamp, and retinal examinations to check for location of inflammation are necessary for proper diagnosis. Laboratories and diagnostic imaging may be requested by your eye specialist to determine an infectious or autoimmune cause of uveitis. Here in the Medical City, South Luzon, we have all of the things here listed, And it's actually for patients in dispense and for doctors to manage and treat the patients properly. Treatment of uveitis depends on the cause and the type of uveitis. It's usually treated with eye drops. If the uveitis is caused by another condition, treating the underlying condition may eliminate the uveitis. And the goal of treatment is to reduce inflammation in the eye. So for anterior uveitis, eye drops are usually the mainstay for the treatment. We usually give steroid eye drops to control the inflammation and to dilate the eye. For treatment for posterior uveitis, we use steroids taken usually by mouth or injection around the eye, and visits to additional specialists to treat the infection or autoimmune disease. Body-wide bacterial infection is usually treated with antibiotics. Treatment of intermediate uveitis includes steroid eye drops and steroid taken by mouth. Severe cases of uveitis may require drugs that suppress the immune system. We call immunomodulatory agents. Usually could be taken by mouth, or injection, or by intravenous infusion, or by the veins. So for anterior uveitis, it usually typically goes away within a few days with treatment. Uveitis that affects the back of the eye are typically, they heal slowly than the anterior counterpart, and usually the relapses are common. Posterior uveitis due to another condition may last for months and may cause permanent vision damage. Seeking proper treatment for an autoimmune disease or infection can help prevent uveitis. In otherwise healthy people, it is difficult to prevent uveitis since the cause is unknown, although early detection and treatment are important to reduce the risk of vision loss, which can be permanent. So it is advised for our patient to do regular eye checkups, and here at the Medical City South Luzon, our eye center is more than welcome to assist you and be partners for your eye health.